Quantification of cardiac iron overload at 3 T MRI in a rabbit model utilizing multi-echo gradient echo T2* sequence. Authors' affiliations, funding support, as shown in the slide. Background. Myocardial iron overload can result in myocardial dysfunction, muscle cell injury, and end-stage heart failure. Advances in technology and an enhanced signal-to-noise ratio have made 3 T MRI more accessible in clinical settings. However, the use of 3 T MRI for early diagnosis of myocardial iron overload remains limited. Purpose: to evaluate the feasibility of myocardial iron quantification using 3 T MRI in a rabbit model of iron overload. Study design. A total of 40 male New Zealand white rabbits were divided into control equals 8 no treatment and experimental groups N equals 32 weekly 200 mg/kg iron dextran injections. Each Sunday 2 experimental rabbits and 1 control rabbit were randomly selected. Venous blood samples 2 milliliters were collected from the ear veins and sent to our hospital laboratory for serum iron level determination. Following euthanasia via intravenous sodium pentobarbital, MRI was performed. Heart and liver tissues were then collected for histological analyses. MRI imaging. Cardiac MRI was performed using a 3T clinical MRI system without electrocardiogram gating. A soft coil diameter of approximately 11 cm was used to optimize the signal-to-noise ratio. Post-cardiac arrest, the rabbits were scanned in the supine position using a multi-echo gradient echo T2* sequence. The imaging parameters included a bandwidth of 1950 Hz pixel and a repetition time of 1000 millisecond. The minimum echo time was set to 188 millisecond. With a total of 12 echoes. An echo spacing of 176 millisecond. A slice thickness of 3 mm. A matrix size of 245 multiplied by 245. A field of view of 260 multiplied by 260 square millimeters. And a flip angle of 90 degrees. Imaging processing. Raw digital imaging and communications in medicine data were transferred to a high-performance personal computer for offline data processing using Thalassemia Tools software, which was also employed for measuring myocardial T2* values. Regions of interest ROIs were manually selected at the mid-ventricular septum in the short axis view and delineated along the endocardium. The software automatically calculated the T2* value of the ROI, which was measured 3 times, and the average value was used for statistical analysis. As shown in the slide, the entire interventricular septum section delineated along the endocardium at the mid-short axis level. B myocardial signal intensity fitting curve for the interventricular septum at each T point T2* equals 1248 millisecond. Statistical analysis. Spearman's rank correlation tests evaluated correlations among a 2* cardiac iron concentration, CIC liver iron concentration, LIC total amount of iron injected, and serum iron SI levels. A p-value is less than or equal to 0.005 was considered statistically significant. Results. The myocardial T2* value in the experimental group was significantly lower than in the control group. Myocardial signal intensity in rabbits decreased with increasing TE. At the same TE, the experimental group's myocardial signal intensity T2* equals 32 millisecond was significantly lower than that of the control group T2* equals 172 millisecond, resulting in a progressively darker myocardium in the images. As shown in the slide, the influence of liver susceptibility artifacts on the myocardium increased with prolonged TES. The top images show an experimental rabbit receiving weekly subcutaneous iron dextran injections for 8 weeks, while the bottom images show an untreated control rabbit. A strong correlation was observed between R2 star values and CIC R equals 0.854. CIC showed moderate correlation with LIC and the total amount of iron injected. A strong correlation was found between the total amount of iron injected and LIC. SI levels showed poor correlation with the total amount of iron injected and LIC, but a fair correlation with CIC. Data conclusion. A 3T MRI with a multi-echo gradient echo sequence may serve as a non-invasive method for evaluating cardiac iron content.